Between glutamate and GABA, this combination, these two neurotransmitters, that's 80% of your brain's neurotransmission. So the superstar neurotransmitters, your norepinephrine, dopamine, serotonin, these, we all know about these, but what's running the show is the balance between your glutamate and your GABA.
Now, let's just dive right in because people are going, what the heck is GABA? What's a GABA deficiency? Now, you've said that GABA deficiency is often the missing link in modern brain dysfunction, especially with anxiety, stress, and insomnia. Can you tell us about that?
Sure. Yeah. So GABA it stands for gamma aminobutyric acid, and it's the primary inhibitory neurotransmitter in your brain. Inhibitory means it calms things down. You have the gas pedal, which is glutamate primarily, and you have the brake, which is GABA. Unfortunately, so many of us walking around right now are GABA deficient, and we don't realize it. We have anxiety, insomnia, we have depression even, and it's all, not all of it, but there's it's sort of like undertone that's happening that clinicians and people don't realize could be because this neurotransmitter is low or deficient. The thing about GABA, Dr. Gundry, is that it's like the brakes of your brain. And so it's like we have all these thoughts that are happening in our brain at all the time. In fact, we have on average about 70,000 thoughts per day. That's on average. And if we're anxious and we're stressed and we're depressed, that number can go up to 120,000 thoughts per day. And GABA is your brake on all that. It works as something called an interneuron. It's basically an area in the brain where you can have these waylay stations where GABA is trying to regulate the flow of information from your sensory system, from your motor system, and trying to bring it all together. So if the GABA system is deficient, and GABA neurons and GABA receptors are everywhere in the brain, if it's deficient, then the brain cannot regulate itself. And so it's overstimulated, it's overhyped. And that glutamate, that excitatory neurotransmitter, is driving the show. And between glutamate and GABA, this combination, these two neurotransmitters, that's 80% of your brain's neurotransmission. So the superstar neurotransmitters, your norepinephrine, dopamine, serotonin, these, we all know about these, but what's running the show is the balance between your glutamate and your GABA. And what's interesting about that is that in the brain, it's actually glutamate that gets converted into GABA with vitamin B6 and magnesium. So it's always the balance between these two. And unfortunately, there's so many things in modern life that are depleting GABA all the time for us.
I need to get me some GABA. So how did we come to a point where, I mean, obviously, we really should have a balance between the stimulatory factors and the off switch factors.
Right.
What's happened that this is now unbalanced?
Oh, it's the hustle culture that you and I both know very well. It's the on all the time, and not knowing how to turn off, because that's not what we're programmed to do, especially Americans, right? And in medical school, for me, we had shirts that said sleep is for quitters, right? You've heard sleep is something you do when you're dead, for example. And this hustle culture, what it does is it drives our sympathetic nervous system. The sympathetic nervous system is the part of our nervous system that gives us fight or flight. It's like you are ready, your action, go, right? Or you can run away if you need to. But the problem with that being all the time on is that it elevates a hormone called cortisol, which increases your blood sugar, affects your mitochondrial function, and also affects the enzymes that are responsible for that conversion over from that glutamate to GABA. So you deplete the GABA and you can't convert more of that glutamate over to GABA. And then as a result of that, you are GABA deficient. I mean, in addition, of course, there's nutritional issues. There's things that are required like vitamin B6 and magnesium that convert that glutamate over to GABA. So our poor diet, our lifestyle, our inflammation in our body, if we have leaky gut, as you know very well, this is going to cause systemic inflammation and going to affect those enzymes. And if you have a gut that doesn't have the right types of bacteria in there too, that's also going to be a detriment to the signaling of the GABA cascades that happen in the brain. Things like lactobacillus and bifidobacterium, for example, are very important microbiota that really help with the GABA signaling. So we are overstressed, we are underslept, we have mitochondrial deficiency, we're inflamed, and all of these things are causing a GABA deficiency. And the problem is that you're going to go to your doctor and you say, I'm anxious, doc, or I'm depressed, and they're going to give you like an SSRI, for example. And we now know, and I'm sure you know this research too, Dr. Gundry, that there's no evidence that depression is a serotonin deficiency. And this is like the words that we would get from the drug companies back in the 90s and up until recently. But we do know that there is an indication that there may be a GABA deficiency going on, but doctors don't know about it. So what I'm really excited to be able to kind of present this information to your listeners, because people need to know this. If you have anxiety, if you have depression, if you have insomnia, it could very well be because that GABA system just needs better regulation.
Let me step back a second, because a lot of our listeners are going to say, well, wait a minute. I thought, dopamine was the pay attention hormone. I'm dopamine stimulated. I'm playing a video game because I want that dopamine hit. Is that not part of all this? Or because everybody's going, wait a minute, what happened to dopamine?
Well, dopamine is our reward drug. It's our reward neurotransmitter. It's a pleasure feeling. It gives you that feeling of satisfaction. And dopamine of course, is a big part of what's happening in modern life, because all of us are getting just slammed with information on a day-to-day basis. And the issue with dopamine fasts and dopamine deficiency, this is all very true, and it's all happening and taking time away. But what dopamine is really doing is stimulating that sympathetic nervous system again, right? So that's the connection. So if your dopamine is up, you're playing video games, you're checking your phone every 5 seconds, you are giving yourself those dopamine hits, those little sympathetic little bumps, little cortisol bumps that are happening every single time that you do that. And that over time, your GABA, your brakes is like, oh my God, there's no more brakes I can give you because you've just depleted me. I don't have enough I'm not able to convert over quickly enough. I don't have the right nutrients anymore. I'm electrolyte deficient, everything else. And so the dopamine part is really the sympathetic dominance part. So the goal really for all of us is to take the gas pedal off and turn the brakes back on. And if we can do that and regulate our nervous system, that parasympathetic nervous system, that rest, digest, detoxify, and recover nervous system better, then we're going to perform better. We're going to feel better. Because if we're overstimulated, as many of you know that are listening, your brain doesn't work as well. But if you can just calm down the nervous system just a little bit, then your brain starts turning back on and you can function better. You're energetically more coherent. And that's what the GABA system and regulating it really can do.
So should our listeners take away so far that they need to go to their doctor and have their GABA level measured?
I love that you asked that. And the answer is no, unfortunately, because GABA is primarily made just in the brain. Now, there are some bacteria in the gut that I mentioned earlier that do some signaling across a nerve called the vagus nerve that helps with GABA production. But what you really need to think about is, number one, it's a clinical diagnosis, and that's hard, right? But as clinicians like you and I, we need to keep it on our radar when people are coming in, and those that are listening have to be thinking about it now too, so they can talk to their doctors. What you can do, although you can't check GABA directly, is you can check for the precursors that are responsible for making GABA in the body, and on some of the micronutrients that are responsible for that conversion over from glutamate into GABA. And so the most common one you can check for is what's called your glutamine levels. So glutamine is an amino acid. It is the primary fuel of your small intestine. And it's also very important for muscle growth. But it also converts into glutamate. And then from glutamate, it gets converted into GABA. So you can check your glutamine levels. I can promise you, if you have a leaky gut, you don't have enough glutamine, because glutamine is responsible for trying to heal up that leaky gut. And if you're kind of addressing the leaky gut, great, and that can be helpful. But if you have a leaky gut, you're going to have a lot more challenges with this whole process overall. And so you can check glutamine levels. You can also check vitamin B6 and magnesium levels, because these can give you a sense of if you have enough magnesium or B6 to convert over. And as I know, Dr. Gundry, 90% of US adults have magnesium deficiency. So it is a big deal. I mean, magnesium is also responsible for mitigating the glutamate signaling as well. So that excitatory signaling that happens from glutamate gets mitigated when you have more magnesium around. It blocks those receptors. And so magnesium is so important for so many things. And I know you've spoken about this at length in various ways. So you can check magnesium, you can check B6, you can check copper, you can check zinc. These are all other things that are in and around the ecosystem that is responsible for making GABA. But in the end, it's a clinical understanding of what this could be presenting as, and then doing some micronutrient testing, doing some gut testing, doing some amino acid testing. And then from there, it's really trying to start working on lifestyle, diet, and then potentially supplementation to help support the system.
Recently, a health influencer who's been around a long time, who has a very visited website, is starting to say that, no, we've got it all wrong. This is a problem with the overproduction of serotonin. What say you?
Well, I know who you're talking about. What I would say is this: our brains, our bodies, our minds are a beautiful ecosystem of networked balance. So you don't want to just demonize one neurotransmitter. I'm not demonizing glutamate, for example. I think it's a fantastic one. It helps with memory, focus, attention, all these things. But in too much, it can cause excitatory symptoms and make people feel anxiety, insomnia, and depression because they don't have enough of that GABA. The same goes with serotonin. I think that there's reason to kind of be upset about the world of serotonergic drugs and SSRIs and SNRIs, because we know now that depression is not a serotonin deficiency. But my sense of things is that this is just something to think about more in a network fashion. We want to have balanced levels of serotonin, dopamine, and norepinephrine. We want to have balanced levels of GABA and glutamate. So I don't think we can really demonize one or the other. But I would say, that there is some evidence that serotonergic on high levels could be detrimental to mitochondrial function, right? So you do want to think about that, of course. So I guess that would be my answer to your question, is that everything's a network, everything should be balanced, and that it's harder to do this in modern life because we have these poor lights and poor environments and stress and toxins, and our mitochondria are taking a big hit, as you know, which are the energy producing part of our cell. And if your mitochondria aren't working well, then everything else kind of spirals from there. And obviously the neurotransmitter ecosystem is a huge reflection of that too.
I think that's the point. Each of these has a piece, but to call out one single piece is I think missing the bigger picture. Thank you.
I'm happy to talk about that, because there are a lot of people out there that will focus on one thing, right? And I am talking about GABA today as a kind of that one thing on some level. But the thing about GABA is that it's such a sort of ubiquitous molecule and neurotransmitter in the brain and what it does. And then it reflects on mitochondrial function. It reflects on your sympathetic and parasympathetic balance, which I think is the big part here, Dr. Gundry, which is that so many of us, as I said, are living in that sort of hustle culture that we don't realize that it's actually when we relax and rest, that when we heal, we detox. And if you're somebody who likes to perform better, even at the gym, you make all of your muscle when you're in parasympathetic mode, right? And so when your insulin level goes up, actually, after you eat, actually your GABA levels actually go up too. And so then that's why you feel better after a meal, is you feel more relaxed because that GABA is going up. And so that GABA is going up, trying to get you into that muscle anabolic state, right? If you're in the sympathetic state all the time, you're catabolic, you're breaking things down. If you can get more into the parasympathetic state, you're in the anabolic state, you're building things up. And as we get older, it's much harder to stay in that anabolic state if you're always stressed all the time, especially.
Now, I know some people who are listening to us go, wait a minute, I've heard GABA. That reminds me of a drug that I'm taking called Gabapentin. Mm-hmm. That's got the word GABA in it. So, and you and I know that there are a great number of people who are given this drug for nerve pain, for neuropathy, and one of the side effects that everyone hopefully is warned about is that you may get really sleepy or your brain may get kind of fuzzy. Are we talking about a similar compound here?
So it's funny, like a lot of drugs in medicine that you well know, Dr. Gundry, they find these drugs and they work, but they have no idea why it works. And that was gabapentin for a long, long time. So gabapentin is a drug that works on the whole GABAergic system, but it does it in a very unique and weird way on calcium uptake in presynaptic neurons, giving it a much higher risk for tolerance, withdrawal, and dependence over time. It's a really hard drug to get off of. If people that are listening, it's really difficult, but it's affecting the GABA system. And this GABA receptor, there's different types. There's a GABA A and GABA B. Mostly we're talking about GABA A receptors. And the GABA A receptors are the ones that have basically an area where GABA binds, and they have an area where what are called allosteric or other kinds of molecules can bind. So the most common thing that binds to GABA that most of our patients, although maybe you and I are maybe different here, are alike in the capacity of alcohol, right? So alcohol is the most commonly used GABA binder. So what it does is it binds to the GABA receptor, the GABA A receptor, and then it increases the affinity for the actual GABA to bind. It binds very tightly to the receptor, and then it can deplete GABA very, very quickly. So this is why you drink and then your sleep is trashed. You wake up 2 hours later because all that GABA is gone and you have all that glutamate that's in kind of high proportion in comparison. So you have headaches, you have abdominal pain, you feel like crap, you can't move. And that's all that glutamate toxicity that's happening, at least a significant portion. So alcohol, though, because it binds so tightly to the receptor, increases your risk of tolerance over time. So you need more dependence on it because you have to have a certain amount, or the system starts breaking down or starting to go into withdrawal. And then, of course, if you stop alcohol too quickly, if you've been drinking a lot, you can die because of instability in your system related to low amounts of GABA. So you have your benzodiazepines that do this too, your benzos, your Ativan, Xanax, Valium. That's why they feel good. They feel good because it's enhancing the GABA system, but again, binding so tightly to that receptor, causing all these sort of downstream things. Like we know if you take one of those drugs, you have your risk for all-cause mortality for anything goes up. And that's the same thing with sleep drugs too, like your Ambiens, Lunestas, all these things. But there are better ways to supplement the GABA system without using those drugs under most circumstances. And that's what I've gotten really excited about from like a diet, from a lifestyle perspective, but also supplementation, but certainly not taking a GABA supplement, because that's not going to work. And we can talk about that if you want to.
Well, I think that's a good place. But you mentioned something that probably went right over everybody's head. What the heck is an orthosteric versus an allosteric modulation? Oh, come on. Help us out here.
Yeah, so this is a pretty easy concept. So imagine you have a receptor, okay? And then the receptor has a molecule that binds it. In this case, it's going to be GABA. So there's going to be a location on the receptor where GABA is going to bind. That's called, the fancy name for that is the orthosteric ligand. So basically, it's an orthosteric ligand is, the receptor binds to the molecule that it's supposed to bind to. In this case, it's GABA, okay? Then you have what's called an allosteric site, allosteric receptor sites. So if you have a GABA receptor, the allosteric sites are not where GABA would bind, but separate sites on the receptor that either can enhance or inhibit the amount of that particular molecule, in this case GABA, to bind to its actual receptor. So you have allosteric modulators and you have orthosteric modulators. So most things that enhance or block the GABA receptor are going to be allosteric modulators. So in this case, we were talking about alcohol, benzodiazepines, sleep drugs. These are also all called PAMs, P-A-M-S. It's positive allosteric modulators of the GABA receptor. So they basically increase the affinity for GABA to bind to where it would bind on the orthosteric ligand. So the orthosteric site of where GABA would bind. So allosteric, orthosteric, I know that's confusing, but in general, just know that there are things that bind to where GABA would bind, and there's things that bind on other sites on that same receptor that increase or decrease how much GABA can bind.
Now, I interrupted you. You said that I just can't swallow my GABA pill and accomplish much. How come?
The problem is that GABA itself is too big of a molecule to get into the brain. The blood-brain barrier prevents many things that don't have transporters to get through, and GABA is one of them. So if you're taking a GABA supplement to try to help you relax, calm down, and it works for you, it could mean because you have what's called a leaky brain or like leaky blood-brain barrier. Now, this may sound scary, and honestly, like it kind of is, but it's really common, especially if you have a leaky gut.
Yep.
These go together. If the gut is leaky, there's more inflammation in the system, there's going to be a leaky brain. And so if you've had a chronic infection for a while, if you have like long COVID, for example, chronic EBV, like all these kinds of things, very much associated with this leaky brain. So, from a clinical perspective, having a GABA supplement and having your patient respond to that is almost diagnostic for that blood-brain barrier not being intact. So in general, what you want to be doing is thinking about supporting that receptor by using compounds that are going to bind allosterically and orthosterically to it, but not using GABA on its own. And there's some really cool compounds that do this.
On the same subject, a lot of mocktails claim are trying to duplicate the effects of alcohol on calming inhibitions, on increasing your socialization. And they claim to be raising GABA levels with various herbs. So are they effective, or are we going to go there next?
So the thing with mostly what they're using is something called Kava. So Kava's been around for a long time. It is a positive allosteric modulator of the GABA receptor. In short, it binds to the GABA receptor at a separate site where GABA would bind, and it enhances the amount of GABA to bind to the receptor. So Kava has an alcohol-like effect, but what's different from Kava is that it doesn't bind as tightly to the receptor. So as a result of that, it doesn't cause the same potential to have withdrawal, dependence, and tolerance, although all those things are possible if you are having a lot of kava. So you have to be careful. So a lot of these other mocktails are using other kinds of herbs in there. Passion flower, for example, is another one. Ashwagandha is another one. Yeah. It also works on the GABA receptor. So these are things that do enhance the GABA system. And when you're using natural compounds, overall, they're going to be less binding tightly to the receptor. So they're not going to have the same kind of addiction, tolerance, withdrawal profile. But it's possible. Valerian root, for example, is another one. Valerian's a commonly used sleep aid. It binds to the benzo receptor on the GABA receptor itself, on the benzo site. And so it works very well for a lot of people. It smells very terrible, as most people know if they've smelled valerian root. It's very pungent, but it does work as well. But my concern here, Dr. Gundry, is that if you're just working on supplementation on those other sites, but you're not actually thinking about your GABA levels themselves and supporting them, you might even get into you might not get into a place where you would with benzos and alcohol, but you can still get into a place where you're depleting GABA even more over time. So it's really important, I think, to be thinking about the whole picture, right? Making sure you can make enough GABA, convert it over to the glutamate. But there are other additional compounds that can actually work just like GABA in the brain and help you prevent any GABA depletion by taking some of these other compounds like Kava or even CBD and CBG and other endocannabinoids, cannabinoids, also bind to the GABA receptor.
All right, come on, don't hold back. What are those compounds? We want to know.
My favorite one, I led you on. I know. I led you on. My favorite one is actually from the Amanita muscaria mushroom. It's also called the fly agaric mushroom. This is a psychedelic mushroom. Many of you have heard of it before. There's some theories that Siberian winters in Russia, where Christmas came about, they were using these mushrooms, drying them and having psychedelic visions. Reindeers love to eat these mushrooms and trip, actually. And there's also Mario Brothers, Alice in Wonderland, a very popular mushroom. There's two compounds in the mushroom. One's called ibotenic acid. That is neurotoxic, so you don't want to have that one. But the other one is called agrin, and it is a long-acting agonist or enhances the GABA receptor by binding where GABA would bind. And its half-life is about 6.5 hours. So it's fantastic for sleep. And you use very small doses of this, a half a milligram, maybe up to 2 milligrams at most. And in these very small amounts, if you combine it with something that's also enhancing the GABA receptor by binding to those other sites, it's this beautiful 1-2 synergistic combination. So you can use Kava with it. You could use another one called magnolia bark or Hanokal or Hanokiol or DHHB, which is a more strong version of that, which is another allosteric modulator positive of the GABA receptor. So our favorite by far is Agrin, because you have this cool story, of course, but it also is fantastically effective. And it's really great to use it in a sleep aid, because in a sleep aid you have the long-acting need for having GABA around, and that GABA support can go a long way from people not only falling asleep pretty easily, but the hardest thing I think for people oftentimes is when they wake up in the middle of the night and they can't go back to bed, mind starts racing. So having the Agrin on board is really a great way to kind of support that GABA system alongside, of having, obviously trying to optimize your sleep in other ways too, but optimizing your GABA system in correspondence. And the other one that we like other than Agrin is something called B3 GABA, nicotinol GABA. This particular compound is a GABA that's attached to a vitamin B3. And what's cool about this one is that B3 has a transporter that gets across the brain. And so B3 kind of takes GABA with it, even if the blood-brain barrier is intact, which hopefully it is. And then in the brain, you have a little bit of B3 and you have a little bit of GABA. And so the B3 is actually mildly activating because it can turn into niacin, NAD. And then you have obviously the GABA, which can bind to where on the receptor where GABA would bind. And so you have this relaxation, but you don't have the fatigue or sedation that often comes with taking supplements or medications that work on the GABA system. So that's another cool one that I like to use, that we like to use.
Now, if we take these mushroom compounds, will the DEA be knocking on our door?
So no, Agrin is not scheduled or anything. It's not going to cause a psychedelic experience at low doses. The only state in the United States that doesn't allow you to have the Amanita mushroom is Louisiana, interestingly enough. But I mean, the mushroom itself, people do use in various concoctions and potions and tinctures and things, but it will have some of that ibotenic acid in it. So I usually don't recommend using it for that reason. I try to avoid things that are neurotoxic in general, if I can. Idea. But so no, this is not like your magic mushrooms or your psilocybin mushrooms or LSD. It's not going to cause you to trip. It's just going to give you that enhanced GABA activity in a more holistic way. So again, the key, I think, is to really replete the GABA on multiple fronts. So looking at it from a diet, from a lifestyle perspective, downregulating your nervous system, looking at your micronutrients, and then supplementing it in a way that you're not only just enhancing GABA to bind, but you're also preventing the depletion of it at the same time.
Perfect. Good summary. We have an audience question. I'm going to let you take this first. I know what you're going to say, but I want Christy813 on Instagram writes, what should I look for in a GABA supplement? Or better yet, what do I avoid on the label? Is there a dosage level I should look for?
Well, this podcast is a summary, or I guess the long summary is the whole podcast, right? The short summary would be that you don't want to take GABA supplements. Like GABA supplements directly do not work. If you do take them and they work for you, it's probably because you need some help with optimizing your gut and optimizing your blood-brain barrier. And you can do that. Work with a practitioner. There's many that can help you here. Just optimizing your gut, optimizing your brain will kind of come in correspondence. And so many people are taking these combination sleep supplements at night. It might have some GABA, it might have some L-theanine, which is another allosteric modulator, the GABA receptor. In general, I have people watch out for anything that would have fillers and sugar and all that other crap that people will find in some of these sleep supplements. But what I like to do is think about this, what we call an obligate pair strategy, a strategy where you're enhancing the GABA system by having something bind to those allosteric sites. So Kava, CBD, CBG, Hanakail, for example, those are some options. And then having something that binds directly to where GABA would bind. So you're not preventing, or you're not causing, I should say, any GABA depletion. So this would be something like Agarin or something like nicotinol GABA, for example. So those are the ones that's the comprehensive strategy where you take one compound that binds to where GABA would bind and one compound that binds to the other site, and you combine them together in a way that really enhances the GABA system overall. So from a dosing perspective, there may be some, everybody's going to be different here. So I usually recommend starting off at low doses of these kinds of things and synergizing them together. And there's various products out there that might be able to help you. And finding your dose, right? I always like to say go low and slow with these kinds of things. Don't, go to the highest dose initially. Start off low and just be careful with your dosing and understand, that it might be a big spectrum for people. And then once your GABA system starts coming back online, you're working on your parasympathetic nervous system. Like, so you're doing breath work, doing yoga, you're exercising, you're eating better glutamine containing foods, you've optimized your gut, your magnesium levels are better. And hopefully you can come and use less of these products, but you can use them on demand. So like if you're in a stressful situation, like you're getting on an airplane or you're about to give a talk or you're about to get a surgery, these are kinds of different reasons why it might be nice to take the GABA and optimize it using a supplement strategy like this.
More amazing episodes just like this one. Watch now. So keeping your mitochondria happy is the best thing. And it turns out glutathione is really good at doing this.